Good morning, good morning, good morning. What's on my mind? Dominica and healthcare. I'm reading with interest what some people are saying. They're in the mud. They're not doing well. The family's not doing well, and they're still trying to support. They're still trying to defend the indefensible. I'm going to tell you, people are dying, and doctors are overworked. There was a young person that went in from the southern part of the island. I'm not going to be very specific, with high blood pressure issue, like 200 plus, right? So that has to be controlled. Somebody like this, you bring them in, start them on some antihypertensive, and you observe them maybe even overnight. Make sure you get a good, regimen for them. This patient was given medication and sent home, and the medication they gave him was not even for high blood pressure. They made a mistake, so that's an error. Patient could have died. Now there's two other incidents. That one was a young man, and again I'm going to be non-specific, went in and I want to say with a headache, and was seen and sent home, and then died a day or two later. There was a lady, an elderly lady, that presented with chest pain. They told her it was indigestion, and sent her home. No EKG, no lab work, and died that night. And there's a lot more. In terms of trauma, we know no one survives. Apparently the young man in the motorcycle accident was talking, etc., etc. Nothing was done. And there's been several, incidents in the past that just is very glaring. I remember my good friend Kurt, who went to SMA with me, very good friend from Louvier. What I heard, about his accident, and like, these things are survivable. So we have a system that does not work, but they try to move pieces around like a chessboard for political gains, and they're playing Russian roulette with people's lives down there, and it's disheartening. I remember in 2015, I forgot when it was, that young lady with the head bleed, when I got involved, and they wanted to crucify me. This young lady also had gone into the hospital a day or two prior, and dismissed and sent home with paracetamol. When you dissect this and you look at it, and you say to yourself, what's going on in Dominica? You have to point fingers at the doctors, because they're seeing what's going on. They're being run ragged, they've been run thin, and they continue to work. They continue to show up, and they continue to work under these conditions and putting patients' lives at risk. So there has to be some blame on the doctors for not standing up. Obviously, the nurses are overworked, and this issue is not about nursing. This is about the politicians and hospital administrators, at least those that pretend to be hospital administrators, that don't know what they're doing, that continue to play political games in Dominica. So this is rather sad. That these are just three examples in the last week and a half or two of people that have been either misdiagnosed, given the wrong medication, and that's problematic, man. If you have to look at it, and you can say, well, where is he getting information? It does not matter. Open an investigation and start looking into your healthcare system. The people themselves need to rise up. The doctors need to go on strike. The nurses need to go on strike, and everybody needs to come together. This idea of meeting people and having discussions, it ain't gonna work. This diplomacy has not worked in Dominica. It's time that people hit the streets. If you want to survive, right, minor high blood pressure and diabetes complication, right, morbid obesity, etc., you better stand up. I don't even want to talk about this live that Lofty had yesterday. I will talk about this at another time. Peace. Dominica is in trouble.